Up next on The Reveal.
I felt like this was a nightmare, like this was a never-ending nightmare.
America's vaping crisis.
I never knew my son was doing it. I'm a mom and a nurse.
They didn't even ask. It seemed very nonchalant. He just took my money.
Our Reveal cameras go undercover to see if enough is being done to keep vaping products out of the hands of children.
These products are not nearly as safe as advertised.
And we see for ourselves exactly what's inside a vaping pod. From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Thank you for joining us. I'm Rebecca Lindstrom. 2019 will be known as the year the public perception of vaping changed. While it's still considered a safer alternative than smoking, it is not without its risks. The habit has caused severe lung injury in nearly 2,300 people and killed nearly 50 others. While the Centers for Disease Control believes it has identified the primary cause, the impact on so many here in Georgia will last a lifetime. It was a 4th of July weekend, a family day on the lake.
My son said, "Mom, I'm having a hard time breathing. I'm short of breath and I feel like I'm having a heart attack." I'm like, "Oh, you're 17 years old."
Amy, a nurse at Northside, wrote it off as a minor respiratory infection. But the next day, she stood in her own emergency room watching as he struggled to breathe.
The doctor comes in and says his lung has collapsed.
The next 4 days were a blur of tubes and chest x-rays, but his lung would not expand.
So the cardiothoracic surgeon came in and says to my son, "Have you been vaping?"
And was that the first time anyone had asked this question?
Yes.
Amy said she then understood why her son, who we have been asked not to identify, was also acting so strange. He was going through nicotine withdrawal.
He was sweating, shaking. He said he felt like he was coming out of his skin with anxiety.
Amy's son had been vaping for a year and a half, the last 6 months heavily.
I never knew my son was doing it. I'm a mom and a nurse.
Stable, the hospital sent her son home to recover, but less than 24 hours later,
I felt like this was a nightmare, like this was a never-ending nightmare. I was like, how can this be?
his left lung had also collapsed. This is an image from inside his rib cage. You're not supposed to see those ribs.
No. This lung right here should be expanded out through the entire cavity. The pulmonologist told me that in 22 years of practice, she had never seen bilateral collapsed lungs. She said this is undocumented for bilateral collapsed lungs.
Related to vaping.
Relating to vaping.
Doctors have seen a lot since then. Remember, this was July. The crisis didn't trigger the Centers for Disease Control to open its emergency command center until September.
He is angry about it.
Who's he angry with?
He's angry at the manufacturers of this crap that's on the market. That's what he tells me all the time. He goes, "Mom, how can they sell that?"
Vape products are unregulated. A federal lawsuit is forcing manufacturers to come to compliance by May 2020 with rules put in place by the FDA more than 3 years ago. But companies defend their products now, saying they were never intended for teenagers.
Really, do you know any adult that would walk into a vape shop and say, "Yeah, I'd like to try unicorn poop"?
Internal emails obtained by The Reveal show Juul paid large sums, $10,000, $89,000, even $134,000 to gain access to students in states like California, Maryland, and Arizona. A congressional subcommittee characterized the company's efforts as a sophisticated program that targeted teenagers and children as young as 8 years old. In one instance, Juul representatives told students their product was totally safe and even demonstrated to the kids how to use a Juul.
For my classmates who were already vaping, it was a sigh of relief because now they were able to vape without any concern.
Some of those students testified on Capitol Hill.
Now they thought it was just a flavor device.
In response, a Juul spokesperson said, "We never designed our marketing to appeal to youth. That is why we're focusing on taking aggressive actions to reduce the access and appeal of our products." But for this teen, the damage is already done.
I think he has PTSD from it. I mean, he stayed in the hospital for 11 days. He had over 15 chest x-rays. He went through surgery, bilateral lungs, and not to mention the cost. My medical bills are over $180,000.
Her son's lungs were covered in blebs. You can see the blisters here on one of his lungs.
The bleb is from the heated vapor. It's a blister, and the blisters pop,
allowing air to escape. Her son ended up having surgery, the tops of his lungs literally stapled to his chest wall. Amy remembers the night before his procedure.
He looks over at me and he says, "Am I going to die? Am I going to make it through this?"
Amy's son says he never purchased vape products with THC, but says he would often share e-cigarettes with his friends to try out a new additive or flavor. He never thought to ask what was in them because until this summer, he always assumed it was safe to vape. Coming up on The Reveal,
They didn't even ask. It seemed very nonchalant.
despite health concerns, why are stores still willing to sell to teens? We go undercover to see for ourselves. The CDC calls it a tale of two epidemics. There's the lung injury health crisis, and then the alarming rise in the number of teens starting to vape. In 2019, 25% of all teenagers will use an e-cigarette, and the nicotine levels in those products will make it difficult for some to quit. Vaping, a swirl of fine particles that can be odorless, even invisible, unregulated, and until recently, thought harmless. I mean, you're seeing kids that are unable to breathe,
Oh, yeah.
that are needing medical assistance
Absolutely, immediate.
during the day.
And it's very scary for all of us.
This school year alone, paramedics have rushed to this Forsyth County high school 6 times.
You know, you have to lock your school down. In the medical community, time is everything.
It's the kind of scene Superintendent Jeffrey Bearden wants to avoid. The district is one of 5 in Metro Atlanta that has increased penalties for vaping, now in automatic suspension, especially when it includes THC.
But it only turns the pink color if there is THC present.
School resource officers have started testing confiscated vape equipment, and there is plenty of it. I mean, are you finding vapes with THC in them?
Yes, ma'am. Yes, ma'am. We've already had 2 confirmed cases already this year.
2 at this school, but 20 cases district-wide. And each case represents a student suspended, some sent to an alternative school.
You like it, you want to do it again.
This senior was one of them. He says his grandfather vapes.
So I never saw it as something more than just help for addiction. But when I saw people doing it, I was like, hey, what's the big deal with it? Not that it would make me cool, but to see what a buzz was like, because I was interested.
Speaking candidly but anonymously, I asked these high school students to tap their foot if they knew any student that vaped or was addicted to nicotine.
You know, like anything else that becomes popular, everyone wants to try it.
Apparently vaping and not getting caught is part of the rush.
If you do it, like, you're cool, like, because the school says so much of, like, don't do it, so, like, they do it.
But before you pass this off as a Forsyth County problem, look at the spike in tobacco-related offenses, most due to vaping, at all of Metro Atlanta's largest school districts. 3 districts even told me they've had to confiscate e-cigarettes from a student in an elementary school.
Every day we're learning more and more about the long-term side effects of...
That's why some school districts have turned to their own students to convince classmates not to vape. From PSA competitions
My chest started hurting.
to a near-death experience.
My eyes felt like they were beating out of my head.
Paulding County High School student London Davis openly talks about the day paramedics had to rush him to the hospital.
Then I started having seizures, and eventually my heart stopped.
Still, his story is not enough. Paulding has already disciplined 98 middle and high school students this year. Students say they are well aware of the risks. They know one Juul pod contains as much nicotine as an entire pack of cigarettes, and that the teenage brain is more susceptible to addiction. They also know it can lead to a lack of impulse control, focus, and mood disorders.
We've been being told about addiction since 6th grade.
None of these students say they vape right now, but at least one admits she might someday.
I don't know, I just don't want to feel like out of place.
If that kind of honesty makes you cringe, fix it. These teens say this one is up to the adults. Change the marketing of vaping, cut off the supply, regulate the industry.
The marketing around vaping has been from the very beginning, safe alternative, flavors that are appealing to young people. All those things mask the dangers.
In the past 3 years, the FDA has issued 80 warning letters to Georgia retailers caught selling e-cigarette products to minors. We mapped the locations, and about a third are within a half mile of a school.
Where are your Juul pods?
Got your ID on you?
Yeah.
The reveal sent an 11 Alive employee that looked underage to stores in Fulton and Cobb counties to see who would sell her vape juice without an ID.
Can I see your ID?
Yes.
You look, honestly, you look about 16.
Really?
Yes, really.
This one, just blocks away from Sprayberry High School, seemed to learn its lesson after getting busted by the FDA in 2017.
Hello. I'm just looking for some Juul pods.
Because our buyer was asked for ID as soon as she walked in the door. In fact, all of the vape shops refused to sell to her.
Okay, well, I don't have my ID.
I can't sell it.
Okay, that's fine. Thanks.
This vape shop manager says he cards everyone.
We ask for ID for every customer that comes in, regardless of age, even if it's blatantly apparent. It's just safer to play it that way.
His shop is in Smyrna, a city that voted to raise the legal age to buy any nicotine product to 21 next year.
I think it's going to help. I think it's going to be a lot easier for places like gas stations who are selling those devices to be able to tell when someone's a little bit underage.
But it's unclear if some of those gas stations even care.
Can I have the mint then? Mint?
How much are these ones?
This one is $16.99.
Okay.
They didn't even ask. It seemed very nonchalant.
Yeah, can I have the pineapple?
He just, took my money.
These teens say none of it matters.
I mean, everyone knows someone that's over 18.
18 is an adult, but a lot of these kids that are buying it are just friends. They don't think of them as an adult figure.
And there are always online sales where all you have to do is check a box claiming to be over 18 to buy.
It's so readily available.
There are a lot of school districts that don't want to talk about this. Why are you willing to?
Well, it's a national epidemic, and I think the best way to combat this issue is to have a community conversation around it.
A conversation that cuts through the haze before a hit on a vape pen stops another heart, but one this teen is grateful he is alive to remember.
That's the day I'll never forget.
Georgia formed a study committee to look at ideas such as banning flavors, increasing the tax on vape products, and requiring licenses for vape shops. No word yet on which of these proposals will go before lawmakers. Coming up,
lead inhaled into the lung is a potential carcinogen that it can cause cancer.
A view from the front line of the vaping crisis. And just what is in those vape pods? We tested to find out. The CDC in Atlanta has found itself on the front line, traveling the country, trying to figure out what thousands of illnesses have in common. I sat down to talk with Dr. Brian King about the research. He says whatever triggered this wave of lung injuries, it started around April, and that this epidemic has made us confront the health risks vaping has posed all along.
So this investigation is very unique. Typically when we have these type of outbreak investigations, they are the result of some type of infectious agent. In this case, we're dealing with a more chronic disease. It's also complicated by the fact that we have cases in nearly all states. At present, it's looking to be like there's some type of chemical exposure that's primarily related to THC-containing e-cigarette products. There's a lot of solvents and other additives that are added to these products, so it's very difficult for even consumers to know what's in the products. E-cigarette aerosol is not harmless to begin with. E-cigarette aerosol can include harmful ingredients, including nicotine, volatile organic compounds, heavy metals, and even cancer-causing chemicals. Lungs were designed to breathe air. The FDA work, they've primarily been working on the state, samples of actual products that have been sent in terms of evaluating what are the ingredients in these products. For CDC's part, we've been dealing a lot of the boots on the ground in terms of working with the states in the self-reported data and some of the clinical symptoms. We have thousands of people that are affected by a severe lung injury, and people are dying, and we're committed to helping to find that cause.
While the FDA tests vape pods from those critically ill, we decided to find out what was inside some of the common products available right now to anyone, anywhere.
Just call it a buzz. It usually relaxes me somewhat.
Andrea Burns started vaping when she was underage.
When I was in school, they were doing it because it was trendy. Just like, oh wow, like I'm drooling and oh, look at the flavors.
The 19-year-old is like many people who vape.
I think they're safer, yes. Far safer.
She believes vaping is safer than smoking cigarettes.
You just can't buy off the street.
These are some of the products cops have seized off the streets. They call them adulterated e-cigarettes containing THC. It's the type of product health officials believe is key to recent illnesses. But what about the mainstream store-bought products? Besides what's listed on the packaging, we wanted to know what's in this stuff.
I'm not exactly sure. There may be something I don't know about.
To find out, we bought 6 different vaping liquids and commissioned a lab in Oregon to analyze them. Light-scale labs tested for 130 common and problematic chemicals, including pesticides and carcinogens, and found these 5 products passed government standards. But this one, Mango CBD, did not actually contain any CBD, but it did contain lead. There is no national standard for a safe amount of lead in vaping products, but California regulators have set their own limit. Our sample tested 800 times over that limit. The company couldn't be reached for comment.
Lead inhaled into the lung is a potential carcinogen that it can cause cancer.
That's Cook Children's pediatric pulmonologist, Dr. Karen Schultz. She's the doctor who treated Tristan Zofield, who you may remember is the North Texas teen seen here fighting for his life as a result of vaping. We took the lab test results to Dr. Schultz to find out what they mean.
I think one of the bigger questions when you look at the ingredients of the vaping liquid is what happens when it gets heated as well. We don't know what happens to all those chemicals when they get heated and then inhaled.
We asked Juul about that. The company says product quality and safety are of paramount importance and said they use third-party labs to perform chemical testing on every lot of e-liquid. Researchers in Oregon, though, have studied what happens to liquid from a Juul pod when it's heated and vaporized. That study determined that Juul vapors are in fact damaging to cells, emphasizing the need to determine if Juul products will lead to adverse health effects with chronic use. Does that make you want to stop vaping?
I'm gonna be honest, probably not, because it was my choice to begin with, I realized the dangers,
Well, there's been a focus on THC-containing vape products during this outbreak. The CDC says 13% of patients insist they only used nicotine-based products. Are you concerned your teen is vaping? Not sure what to do about it? The Partnership for Drug-Free Kids has created a guide for parents to figure out what they're vaping and how to talk about it. We have posted it on our website, 11alive.com. Thank you for watching The Reveal, the nation's only weekly local investigative show. We'll see you next Sunday for The Reveal.